Can you hear me?
Yes, we can.
All right. Good evening. My name is Robert Lilly, and I am grateful for the opportunity to be present and to put my voice into this space this evening. I am 52 years of age, and I have spent approximately 21 years of my life inside a penal institution. I'm currently receiving medical support from the Black Men's Health Clinic, and I want to speak not for them, but for myself as a recipient of their benefit, their benevolence, and the work that they're doing in the community. I heard about this meeting tonight only as a result of the outreach that they put forth on the social media, which enabled me to register in time to be a part of this conversation. There's another thing I want to lift up this evening, besides speaking in support of more funding for the Black Men's Health Clinic, is including voices in this health equity vision that have been directly impacted by incarceration. I had never seen a dentist or a doctor in my youthful life except in some sort of institution. I recently came home after 4 years of incarceration, and I'm now pre-diabetic, and I'm receiving care expressly for that purpose at the Black Men's Health Clinic. Thankfully, I've lost about 4 pounds since I returned home. I say that because traditionally I had no interaction with systems that are supposedly designed for our care because my trust level was extremely low for these institutions. I had received in my past many traumas as a result of interacting with them. But when I heard about the Black Men's Health Clinic through my partner, who actually heard about them at the African American, Central Texas African American Family Support Conference, I was immediately intrigued and put it on my plan for reentry to visit with them when I returned home. Upon my release, I located one of their flyers and immediately set off to engage with them. When I got there, my experience from the beginning to the end was edifying and uplifting. The people at the front, I mean, I was greeted by somebody as soon as I walked through the door. I was made to feel comfortable. The conversations I was having with the people at the front desk were not conversations with people that were just service providers. These were human beings that saw me as a human being. And I can't speak enough about what it feels like to go into an institution and to receive that kind of support and embrace. So again, I'm speaking to say to you, whatever you can do to increase the funding for this agency, this organization, I stand in solidarity with those who have already spoken for that purpose. And then lastly, again, however this conversation is going to evolve in the future, whomever I need to contact, I think I see you on the website, Ms. Yesenia, to reach out to be a part of this conversation ongoing, including the voices of those that have been impacted by our carceral systems. I would like to be noted to be invested in that process. I think, as one of the refrains goes in my community, nothing for us without us. That means if you're going to have conversations that relate to our needs, it is imperative that you include us at the table and allow us to express our unique position in this society. I thank you again for the work that you've already done in supporting health equity and removing barriers to access. And I look forward to working with you in the future. God bless.